Preparation is the key. Make sure everything you need is to hand before you start. Inspect the foot and particularly the heel to identify the area which requires pressure relief. If required, apply appropriate wound dressing as indicated in the treatment plan. Apply 1 layer of blue or yellow line Tubifast from the knee to the toes. The use of blue or yellow line will be dependent on the size and edema levels of the foot. Next, apply FLEX or Pro4 wool from the ankle towards the toes, making sure you overlap by half and have good coverage over the heel area. Apply a folded length of wool over the dorsum or top of the foot. This allows you to cut against the protective wool rather than the foot when removing the cast. Apply another layer of blue or yellow line Tubifast from just above the ankle to the toes, ensuring there are no wrinkles or creases. Apply the semi-rigid casting tape, working from just below the toes, overlapping the semi-rigid casting tape by half, just above the ankle, ensuring you apply enough tension to prevent creases and wrinkles. Fold over the semi-rigid casting tape 3 or 4 times and cut. Apply to the area that requires pressure relief. Apply dampened bandage over the semi-rigid casting tape to allow the cast to set. Leave to set for 4 to 5 minutes until the cast becomes less tacky and hardens. At this stage, if required, change gloves. Remove the dampened bandage and discard. Holding the top layer of Tubifast, cut the cast open along the dorsum or top of the foot, cutting against the folded layer of wool, being careful to avoid trauma to the skin beneath. Remove and inspect the cast to ensure there are no ruckles in the cast lining and creases in the plaster. Check to see if the FLEX wool and initial layer of blue or yellow line Tubifast are dry. If damp, remove and reapply. Apply a new layer of blue or yellow line Tubifast over the FLEX wool. Cut the cast into a heel cup shape so that it fits just around the ankle bones. Re-inspect the cast. Mark the cast with either left or right foot, the date it was made, your initials, the name of the patient, and heel and toes to ensure the cast is always put on the right way. Ensure a snug fit. Apply bandage over the cast to hold in place and secure with tape. It is recommended that the cast is removed and reapplied after 2 days to ensure there is no skin irritation or trauma. If satisfactory, the cast should be checked every 2 to 3 days as the treatment plan dictates.